Thank you very much. The problem of ghost networks is particularly harmful in mental health care and one arguably made worse in recent years. Amid the nation's ongoing mental health crisis, though, the pandemic and beyond, those desperate for help continue to get ghosted. And reality is that there just aren't enough providers. I was proud to secure my colleagues on the committee 100 new graduate medical education slots reserved for psychiatry in last year's Consolidated Appropriations Act. Last week, I reintroduced my Resident Physician Shortage Reduction Act alongside Senators Boozman, Schumer, and Collins. It's a bipartisan bill would raise the number of GME positions by an additional 14,000 over 7 years. So, Dr. Resnick, would you agree that increasing graduate medical education positions would complement efforts to improve provider directories and mental health access overall?
Senator, I cannot thank you enough and agree enough that, and the 100 additional slots for psychiatry, every little bit helps, but the larger act is absolutely necessary as we face an aging population. We need more physicians for this country, so thank you.
Thank you. Dr. Trestman, for children in care of need, the problem's even worse. According to the data by the American Psychological Association, only 4,000 out of more than 100,000 U.S. clinical psychologists are child and adolescent clinicians. What can Congress do to specifically address the workforce shortage of child and adolescent mental health clinicians?
Senator, I think that the trajectory that you and your colleagues have started has been wonderful. We need to think broadly about the needs of healthcare in this society, and so training at the community college level, the college level, getting people in the pipeline for allied health professions, whether it's nursing, social work, community health workers, as well as psychologists and physicians. We need to think broadly so that we can provide adequate care, and many professions other than physicians can be trained in a more timely way, and any of the ability that they have to provide care, whether through social work or others, can make a profound difference and really expand and leverage the care that only physicians can provide. Mm-hmm. Thank you.
Mm-hmm. Well, imagine for a moment that you or someone you love is in the midst of a mental health crisis. You call 70-plus doctors listed in your insurance plan's network. Not one is available for an appointment within 2 months. Most never call you back. Some are retired. Others are deceased. Some phone lines are disconnected. This is the reality for far too many people seeking mental health care services in New Jersey and across the country. It's critical that people seeking mental health services have access to accurate, up-to-date provider directories. This outdated information hurts people when they are desperate to get help for themselves or a loved one. Ms. Gilberti, what mechanisms can federal regulators use to hold those responsible for providing, for provider lists accountable? How can we highlight how CMS can better enforce regulation and oversight of provider directors?
I think they could do several things. One, we could have audits of these plans for their behavioral health networks, and those audits could be done either by CMS itself or by a third party, and transparency, right, the results of that. We've also talked about making sure it's included in the star rating system so that it's really, they get incentivized to make those changes. And we've talked about civil monetary penalties, which currently don't exist, right? So that's another way, and they'd have to be sufficient to affect behavior. So those are an array of choices that could make a difference if they were combined together.
And finally, we have to address the challenges of ghost networks, but we must also prioritize policy that support low-income and marginalized populations. Last week, HHS released proposed access and quality standards for Medicaid and CHIP. Among other things, these proposals would require states to conduct, quote, secret shopper surveys of Medicaid and CHIP managed care plans to verify compliance with appointment wait time standards and to identify where provider directories are inaccurate. How would these requirements mitigate impacts of ghost networks for low-income communities, Ms. Myrick?
Thank you very much for asking that question. And I think anything that can help, especially folks of color, people in low-income communities, be able to get the accurate information that they need in order to get the care when and where and how they need it, is going to be critical. And I also added that being able to empower the consumer, the word consumer, I actually like it. I know in our community sometimes it's a little, people don't like it, but the reason I like it is I think of John F. Kennedy's Consumer Rights Bill and what he talked about in 1962 about the consumer's rights to be heard, the consumer's rights to have information, to make a choice, and then lastly, the UN added to redress. And I think the things that you're talking about give us those rights, especially if we have something like a 1-800 number or a online portal to report when we are not able to get our needs met because of the ghost network. Because we want to inform too. We want to be empowered to inform so that either the carrots or the sticks can happen. So thank you.
Thank you very much for your insights.
On behalf of the chairman, I call on Senator Blackburn.
Thank you.